Hi, I'm Kelly Schwartz, CEO of Schwartz Consulting Group. We work with over 850 practices throughout the country, and today we want to show you some of our favorite features within dental intel. So, when we're looking at how to best use DI, one of my favorite features is the unscheduled patient list. So right here, we use this primarily for hygiene and filling hygiene. And we've defined what we call the right patient. And when we've surveyed and talked to all of our practices, we ask them, what is the ideal patient? It's a patient who will show up, who has a good track record, a patient who needs dental care, and that we can basically count on. So to find that patient, we like to click within this unscheduled wheel. 0 to 6, 6 to 9, 9 to 12, 12 to 18 are just the time frames in which the patient was in. It's not how overdue they are. 18 to 36 are considered inactive by dental intel, but they're not inactive in your practice management system. So when we train our teams how to work or fill hygiene with the right patients, we click within this wheel, and in here we go from total to hygiene past due. So in this case, we have 433 patients who've been in the last 18 months that are unscheduled. We click the total bar over here to the right, and we bring the unscheduled treatment to the top, the patients needing the most care. Within here, we then start our systems of calls, text messages, and scheduling our local med or Medental scheduling link. So in here, everybody on the team can see how many times they've been called, when the last call was, and having a follow-up date. So when we click on the patient's name here in HIPAA mode, we simply create a follow-up for the hygiene recare. We can assign it to anyone because anyone can do it. Once that follow-up has been created, we then start in our systems of calls and text. So in this case, we call them. If we didn't reach them, we'll click here. We'll make a note on what we did. For example, left message and sent the local med link. And we will pick a date, let's say in 10 days, that we're going to follow up with that patient. Then we simply go back here and we can send them their link as well for the adult returning cleaning. Local Med has already scripted this. We can then hit send, and that patient will receive a link that allows them to schedule at a time that is convenient for them. Now, what we're looking for in terms of a goal for the practice is to keep the hygiene relatively full. What I mean by that is we want to have an average of 0.85 patient visits per hour. What that allows for is your hour and a half of new patient or an hour and a half for 2 scaling and root planings. But this basically tells us that our team is keeping hygiene full almost every hour. So in this case, you can see we had 1 visit per hour, 0.97 visits, 0.97 visits for the entire month of October. When the entire team is involved in the process, which is what we teach, you can also see the results that come from that. So this team, during the entire year of 2024, working their recall system that we've trained them, have scheduled over $140,000 and roughly estimated the effort is yielding $51 per phone call, text, or appointment. So we really want to see you drive your hygiene program home, not just keeping hygiene full where patients may not need care, but really focusing on those that need you most. When offices today are short-staffed and really need to make sure they're staying at the top of their game, putting the patients that need care in should really be the focus. So we hope you find this tip helpful. If we can help you in any way, I'm Kelly Schwartz, Schwartz Consulting Group.